So in this video, I will be discussing about charting, specifically charting in the nurse's notes. So when we say nurse's notes, these are written facts regarding patient and the care provided based on assessment data as well as the patient's response to interventions given by the nurse. So ibig sabihin as a nurse, kapag tayo ay gumagawa ng ating nursing procedures or yung nursing process natin in the hospital, dito natin nilalagay yung ating charting or yung ating documentation in the nurse's notes. Okay? So lahat na nag-transpire during the shift, during the duty, together with our patient, dito natin siya inilalagay. Dito natin siya dino-document. Now, we have different purposes of the nurse's notes. First is to communicate the facts concerning a patient from one nurse to another. So, nilalagay natin dito yun nga, yung mga nangyari during the shift, only facts concerning our patient para yung susunod na shift na nurse, malalaman niya kung ano yung mga ginawa natin during our shift so that meron siyang basis, makikita niya yung document natin, yung ating documentation. So, ito yung magiging basis niya na ito pala yung mga naibigay nating care to our patient. So that kung may question siya, kung may clarification siya, he or she can just look at our documentation or charting in the nurse's notes. Number two, to make an accurate record of events, observation concerning a patient. So we are only documenting accurate events or yung mga events na talaga nag-transpire with our patient. Okay? Kung ano talaga yung mga naibigay nating care, kung ano yung nagawa natin to our patient. Okay? So, number three, to provide information for the physician and other members of the health team. So, it provides details sa ating mga kasamahan sa na healthcare providers sa ospital kung ano yung ating ginawa as a nurse. And then number four, to make a record of medication, treatment, diet, diet given, and the reaction of the patient to this care. So, yun na nga, overall observations or assessment natin sa ating patient, nilalagay natin dito. Plus, yung mga medications na prescribed by the doctor, the nursing interventions or treatment that we have performed, and yung mga orders ni doctor na ating nagawa. So, dito natin siya dino-document. Now, when we say charting in general, it is a permanent record of the patient's data, vital signs, and progress in the form of graphs and charts. So, kaya siyang tinawag na charting. So, it's like a chart na it is like a form of graphs and chart. So, meron siyang different sections or different parts such as kung saan tayo pwede maglagay ng patient's data, kung saan tayo pwede maglagay ng vital signs of the patient. Others are the input and output of the patient, the medication sheet or the medication list of the patient, yung mga naibigay natin sa kanya, the IV fluid sheet, among others. Okay, so marami ito. So charting in general, so ito yung lahat ng documents na na ito yung mga documents na naglalaman or that talks about our patient's health. Okay? Ito lahat ng documents na um, na, na tumutukoy sa kalusugan ng ating pasyente. So, magkakasama lahat yan sa isang chart. It is compiled under one chart or sa iisang chart. Lahat ng documents niya magkakasama, pero magkakaiba siya ng sheets or ng sections. Okay? And then, arrange yan chronologically or orderly depending on the agency or on the hospital na pinagjudyutihan or mapagjudyutihan nyo. Now, charting in nursing provides a documented medical record of services provided during a patient's care, including procedures performed, medications administered, diagnostic test results, and interactions between the patient and the healthcare professional. So, charting, so ito yung ito yung isa sa mga tungkulin natin as a nurse na kailangan nating ma-perform when we are giving care, when we are giving due care to our patient. Because again, ito ay isang medical record at legal basis siya um, na pwedeng magamit, okay, for legal purposes if ever, if anything happens to our patient. Okay? So dito natin may papakita yung mga care na binigay natin, yung mga procedures, yung mga medications, diagnostic results, and yung interactions ng bawat healthcare providers na binibigay nila in relation to the patient. Now, we have different types of charting in nursing. So, depending on your institution, ito yung different types of charting na commonly used by nurses. Okay? So, we have source-oriented charting, and one type is we have narrative charting. So commonly, we call this as traditional charting. And before, ito yung most common na charting na ginagamit here in our context, si narrative charting. Next, we have problem-oriented charting. An example of this are SOAP or SOAP, o kaya SOPI. Okay? And then we have problem intervention evaluation charting or PI. And then ito ngayon yung parang mas nagagamit na sa ngayon. The focus charting, or this is also called as FDAR charting, or yung DAR, FDAR, F is focus, DAR would mean data action response. So many hospitals are now um, using or implementing the FDAR charting. Next, we have charting by exception or CBE. Now, please take note that we integrate the nursing process in all of this charting. So yung assessment natin, again, yung diagnosis, yung planning, nursing intervention, and evaluation, lahat ng ito, yung the nursing process na ito, kahit anong man yung charting na gamitin natin dyan, we integrate the nursing process. So again, you have to refer to your agency's guidelines when it comes to your charting. Okay, so um, again, this is the purpose of charting in nursing is to maintain an accurate record of the patient's condition. The patient's chart is a legal document and must be considered as such. Kaya we are very careful in giving or providing documentation dito sa chart or sa ating pag-charting because this is a legal document. Okay? So, dapat wala tayong error na makommit in charting or in documenting. Later on, I will show you what are the different um, things that you have to remember when you are doing your chart or when you are documenting. Now, what are the qualities of a satisfactory record sheet or chart? Okay, so these, again, the different qualities of a satisfactory record sheet or chart. So these are number one, accurate. So dapat ang nilalagay lang natin yung mga tamang nangyari and it must be factual. Okay? We should only chart based on facts and we should be accurate in our charting. Next, for it to be a satisfactor a record na satisfactorily na mako-comply natin, it should be legible, meaning readable siya or can be read easily. Okay, so in short, dapat maayos yung ating pagsusulat. Next, it should be neat, meaning no erasures or no whiteout. So bawal as much as possible, wag tayong ah, mag erase. Okay? So we have a specific procedure or guidelines kapag ka tayo ay mag-erase or meron tayong i-correct sa entry na or na chart na natin, tapos mali pala, then we have a guideline kung paano natin siya buburahin or paano natin siya aayusin or itatama. Pero again, bawal yung whiteout, yung paggamit ng ano din ng snowflake or yung pag-e-erase. Okay? Yung totally na i-erase mo yung words na naka-chart na bawal din siya. So later on, I will show you how to properly correct a mistaken entry. Next, uniform. Kailangan uniform tayo sa pag-chart. Hindi pwedeng yung isang nurse, ganito siya mag-chart, yung iba naman, iba yung kanyang technique or yung kanyang way of charting. So it should be lahat ng nag-chart, they should be uniform. So it must be written in printed, not longhand style. So kailangan handwritten lang yung ating charting. Kasi here in the Philippines, most common pa rin yung talagang charting. Okay? Yung physical, I mean, charting, the way na magsusulat tayo. Pero in other countries, common na yung electronic charting nila or yung using their iPads or their gadgets on their charting. Okay, that is nursing informatics. Pero in our case, most common pa rin talaga yun. Nagsusulat tayo. We have the form and then we chart. Handwritten. Okay? Nagsusulat pa rin tayo. And then complete. The chart should be complete, properly endorsed, and signed. So when we say complete, from start, from the time na na-receive natin yung pasyente up to the time na na-endorse natin yung ating pasyente to the next shift, dapat complete lahat ng entry. Lahat dapat was or is properly labeled, properly naayos natin, organize natin, and properly secured. Okay? So, that is the quality of a satisfactory record sheet or chart. Now, what are the different rules in charting? Number one, do accurate, concise, and neat chart. So, dapat malinis tayong mag-charting. Okay? And then, write factual observation and statement, just like what I have mentioned before. And then, use standard ink. For, again, yung paggamit ng kulay ng ballpen, it depends on your agency or on the policy or guidelines of your institution. For example, this is just an example. It may vary from different institutions. Okay? Example, we use black ink, this one, for number one, charting from this is 3 p.m. to 11 p.m. shift. So yung mga nurses na mag-duty na 3 p.m. to 11, so they use black ink to chart doon sa nurses notes or doon sa progress notes. And then chart numbers and patient's name in all headings. We use black ink or black ball pen. And then all information including history on admission sheet. So these are just examples where we use black ink. Next, for another example naman, red ink, we use red ink for charting naman ng mga duty nurses from 11 p.m. to 7 a.m. shift. Okay, so red yung ginagamit nila. And then medication and the term discontinued on medication sheet, ginagamit din yung red ball pen or the red ink. And then you use blue ink for charting from 7 a.m. to 3 p.m. shift. So yung mga nurses na duty during this time, so blue ball pen naman yung kanilang ginagamit. And again, this is just an example of a hospital protocol kung paano nila ginagamit yung different colors of their ball pen. Okay? Next, another rules in charting number 3, admitting nurse or the clerk are responsible for completing admission data as well as for the vital signs on admission. So, kung sino yung nag-admit, siya yung responsible, I mean the admitting nurse or clerk or again, depending on your institution, siya na rin yung bahalang mag-complete ng admission data or information including the VS of the patient upon admission. Okay? And then print record in plain, legible characters, proper spacing of words should be observed and should not be crowded. So, ibig sabihin, legible pa rin dapat yung ating pagsusulat. Okay? Tama lang yung spacing, hindi masyadong crowded, and madaling basahin. Okay? Number five, do not use an authorized abbreviation. So, na-discuss na natin kung ano lang yung mga abbreviations na pwede nyo magamit in the hospital at nalaman nyo rin what are the different abbreviations na hindi dapat natin ginagamit. Okay? Next, record diets in the chart. So, ini-indicate natin yon as per the physician's order. Post the laboratory and x-ray results on the laboratory sheet. So, meron tayong laboratory sheet doon wherein or laboratory section kung saan nilalagay natin lahat ng lab results. Okay? And then when error in charting or graphing is committed, do not erase or crush out. Okay, for example, you're a student, huwag kayong mag-erase or do not crush out the paper. Or yung kahit anumang technique na gawin nyo para ma-erase. So, you have to report to your CI the error and then you will be advised ng CI ninyo kung ano yung dapat gawin para makorek yung mistaken entry or yung error sa pagcha-charting ninyo. Okay? You should be guided by your clinical instructor or the nurse on duty. Okay? If hindi, for example, hindi makita pa si CI or busy, so you can ask always for the assistance of the nurse on duty. If you are a student, Now, for the different types of charting, I will now be discussing kung ano-ano yung mga different types of charting na meron tayo. Again, we are placing our documentation or our charting as a nurse under the nurse's notes or in the nurse's notes section. Okay? Sige. First, we have the narrative charting. Okay, so when we say narrative charting, it provides information in the form of statements that describe events surrounding patient care. If it is unstructured, providing flexibility in determining how information is recorded. So later on, I will show you an example kung paano ba ginagawa yung narrative charting. Okay? So ito, we just state, okay? Or we are just describing kung ano yung mga events na nagtatranspire during our shift. Kung ano yung mga nangyayari during our patient care. Okay? Again, wala naman siyang, hindi siya masyadong stiff when it comes to charting. Very flexible siya. And then, it follows a sequence of events. Ginagawa natin siya um, based on the time na ginawa natin yung care to our patient. So, siya, para tayong nagsusulat lang sa ating diary, para tayong nagkukwento lang sa ating diary. Okay? So, that's how we do the narrative charting. It may be time consuming and makes retrieval of information and tracking of progress and outcomes difficult. Sige, to show you an example, ito siya. So this is an example of a narrative charting. So this is in nurse's notes, okay? So you write here the name of your patient and then kung ano yung ward, for example, medical ward, surgery ward, OB ward, or kahit ano man yan. Again, the structure and how you chart, it will depend on your institution. Pero this is just an example. So we have your three columns for this form. So we have here the date, we have the time, and we have yung pinaka pagsusulatan natin ng chart or ng documentation natin. So for the date, we just write here the date today or the date when we have when we had our shift, and then the time, ito yung time na ginawa natin yung procedure or yung care sa ating pasyente. Now, take note, kulay blue yung nakalagay dito kasi again, yung according dito sa ating um, agency protocol, the 7 a.m. to 3 p.m. shift should be in blue ink. Okay, so ito medyo nagkamali lang na it should be in blue. Okay, so blue ink dapat siya. Ayan. Kaya blue yan. And then for 3 to 11 p.m., black ink na. Okay, so kaya kung napansin nyo, naka-blue ink siya because it's 7 to 3 p.m. shift. Okay, for example, ganito po yung narrative charting. Na-receive natin at 7 a.m., nag-start na tayo ng shift and na-receive natin si patient on bed. Okay, 7 a.m., receive patient on bed. Okay, so that's the usual. Okay, kung paano natin na-receive yung patient. Pwede namang um, receive patient sitting on a chair. Okay, depende kung how we receive our patient. Okay? Or receive patient standing or receive patient sleeping in his bed. Okay? Or on his bed. So again, it depends kung paano nyo marireceive yung inyong pasyente. And then oriented, if you receive the patient na kung nakakausap nyo siya or nakapag-establish kayo ng rapport, so you can say na oriented siya or simply um, ayan, oriented talaga yung most of the time na ginagamit natin na term. Sometimes kasi nilalagay nila um, conscious and coherent, pero commonly, ang ginagamit na is oriented talaga. Okay, next, for example, you have observed na with on and off pain on hypogastric region si patient. Okay? So, yun ang kanyang verbalization. By the way, um, at the start of at the beginning of our charting, ito na, we are collecting first the data. Okay, subjective data and then objective data. So in this case, subjective data. After we receive the patient, and then kung paano natin siya na noticed during our um, pagsimula ng shift, ito na, kumukuha na tayo ng subjective data. Okay, so first we have kung for example, sinabi niya na meron siyang pain sa kanyang hypogastric region, so you will be asking him the pain scale. Okay, so 0 being the lowest, 10 being the most painful na pakiramdam niya. Okay, so in this case, for example, he said 5 out of 10 yung kanyang pain scale. So we just document na kung sinasabi niya na pasulpot-sulpot yung kanyang pain sa hypogastric region. So we document na with on and off pain on hypogastric region. And then kung sinabi niya rin na siya ay parang masusuka pero hindi naman siya talaga totally nagsusuka. Parang medyo nahihilo-hilo lang tapos feeling niya masusuka lang siya, parang ganon. Pero totally hindi naman siya talaga nagvo-vomit. So we document that as for example, nauseated at nauseated. Okay? Yung feeling na masusuka pero hindi naman siya nagvo-vomit. Ayan, take note of the spelling. Ito typo error lang to. Okay? So nauseated. Okay? So again, take note of your spelling kapag kayo ay mag-chart. Okay, next, with IVF of ENSS, 1 liter, around 450 cc regulated at 41 to 42 drops per minute. So after the subjective data, ang susunod mo na is the subjective, I mean the objective, kung ano yung na-observe mo pa. So ito, nakita mo na yung mga nakatusok or yung nakalagay kay pasyente, so yun yung ilalagay mo. Okay, so IVF, that would mean intravenous fluid of PNSS. So when you say PNSS, plain normal saline solution, 1 liter, around 450 ml or cubic centimeter, regulated at 41 to 42 drops per minute. So again, you can use this accepted naman yung mga abbreviations na to. Okay? And then, with short arm, for example, orthopedic kasi to, no? With short arm fiberglass cast on left arm. So, kung nakita mong nakakast siya, kasi may fracture probably yung pasyente, so, ilalagay mo yon. Okay? So, ayan. For example, naka-oxygen si pasyente, ilalagay niyo lang din with oxygen via nasal cannula regulated at kung ano yung kanyang regulation. Okay, for example, 1 liter per minute. Okay? So, next natin. So, yung kanyang diet naman. So, we will indicate after the objective data and the subjective and the objective data, indicate naman natin kung ano yung diet niya na. So, on NPO. Okay, so next, after indicating the diet on NPO, again, pag sinabing NPO, nothing per orem or pwede ring nothing by mouth, okay? NBM, nothing by mouth. Pero commonly, we use NPO, nothing per orem. Okay? Ibig sabihin, bawal siyang kumain ng kahit ano. Now, at 10 a.m., for example, for urinalysis siya requested. And then for fecalysis, meaning ito na yung mga lab procedure na in order ni doctor na gagawin sa kanya. So, ito, mga 4 pa lang. Ibig sabihin, gagawin pa lang. Okay, 10 a.m. And then 11:30 a.m., for example, nag-rounds si Dr. Morales with orders made and carried out. So, every rounds naman ng doctor, kine-carry out natin agad yung kanyang order. Okay? So, usually this is how we document that. So, rounds by Dr. Morales with orders made and carried out. And then, we also document kung ano yung mga health teachings na binigay natin sa pasyente or kung ano yung mga information na binibigay natin sa kanya or instruction. For example, ito, instructed patient to maintain NPO. Okay? So, again, typo error, ano? Be careful with your spelling. Instructed patient to maintain NPO. Next, keep the casted arm elevated and report any itching or pain sensation. And then practice deep breathing exercise and self-hygiene. Comply to medical regimen. So these were the instructions given to your patient during your shift. Okay? So ibig sabihin naibigay na natin to. So you have to document everything na nasabi nyo kay patient. And then for example, na-advance mo kasi yung charting mo, okay? Pero bawal yun, ano? Huwag kang mag-advance charting kasi hindi natin masasabi. Mamaya, nasa guidelines yun, I will tell you. Pero for example, nailagay mo agad 3 p.m. endorse, tapos nakapag-sign ka na, Juan de la Cruz, for example, IDC, Student Nurse 2023, and then assign mo na. However, bumalik si Dr. Morales, tapos may inad siyang order. So, nakapag-close ka na ng chart mo ng nalagay mo na 3 p.m. pero 2 o'clock pa lang pala. So, anong nangyari, nung 2:30, dumating si Dr. Morales tapos may additional order siyang binigay. Okay? So, hindi mo pwedeng burahin na to, right? Again, bawal tayong mag-white out, bawal tayong mag-erase. So, ang gagawin mo as a student nurse is to, ilalagay mo rito sa next na line would be addendum. Ibig sabihin, additional entry mo to aside from what you have already indicated here. So, 2:30, dito siya nakababa siya dapat dito sa rounds by Dr. Morales. So 2:30, addendum, tapos 2:30, tapos ano yung nangyari? Ano yung addendum mo? So for example, rounds by Dr. Morales with orders made and carried out. Pero usually, ini-specify natin kung ano yung order na yun dito. Okay? And then, if okay na siya, kung totally wala na, so, yun lang yung addendum mo. So, again, dito wala lang yung pirma ni CI and nurse on duty. Pero ito dapat yung mga magka-countersign ng inyong documentation. So, dito kayo, for example, you are the student of Juan de la Cruz, IDC or any UST-2023. So, pirma kayo on top, and then your clinical instructor, and then pirma, and then the nurse on duty, ka-counter sign niya din. Okay? And this is how your narrative charting looks like. So, yung pang 3 to 11 p.m. na, so 3 p.m. yung start niya, and then receive patient on bed na naman siya, pero black ball pen ang gagamitin niya. Okay, so this is an example of a narrative charting. So, parang nag-entry ka lang sa iyong diary kung ano yung mga nangyari during that time, kung ano yung mga procedure na binigay mo with specified time. Okay, so that is narrative charting. Next. Next, we have API charting or API charting. So, the process begins with the admission assessment that is usually completed on a separate form and the initiation of problem list. So, documentation of client care is focused on interventions and evaluation related to the problem listed. So, ang process natin for the API charting is APIE. So we have A for your assessment, P is for problem identification, I is for the interventions, E for the evaluation. Okay, so let us see an example para mas ma-visualize or mas maintindihan natin kung ano naman at kung papaano yung charting na ito. Okay, so we have here a problem. Okay, for example, so you have here the date and then the time. Okay, so ito lang yung example na maibibigay ko sa inyo because hindi siya ganun ka-common na ginagamit dito sa ating context in the Philippines. Okay, so problem number 1, the problem identified is pain related to surgical incision on the abdomen. For example, na operahan sa pasyente. So, one common complaint yan or chief complaint is pain. So, that could be a problem. So, in this case, that is the identified problem. So, for the A, okay, this is the assessment. So, you have to indicate here kung ano yung na-assess mo. For example, complaints of pain to the abdomen, status post, ibig sabihin, ang kanyang condition ngayon ay kakatapos na ng kanyang operation. Appendectomy yung ginawa, day 2 na. Okay? And then, pain scale lagi, kapag ka may pain na sinabi sa pasyente, you always ask him or her for the rating. Pain scale. Okay? So, ito yung yung basis of the scale. 0 is no pain. 1 to 4 is tolerable pain. 5 is moderate pain. And then 10 is the worst pain. So, ang kanyang rating is 5. Sabihin moderate pain. And then so that is subjective data. After subjective, again, you have objective. So we have here facial grimace noted upon movement like walking, tapos nawawala or alleviated by lying on bed. So nawawala yung pain kapag humihiga siya. Pero pag siya ay naglalakad, nakikita mo yung kanyang facial grimace ni pasyente. So, and then nag-request si pasyente for pain medication. Okay? And then P, this is for the problem kanina, di ba? Pain related to surgical incision on the abdomen. I instructed to perform, ito yung I is for the intervention. So for example, you instructed the patient to perform deep breathing exercises 10 times. Ito yung ginawa para ma-relieve yung kanyang pain. And then turned to an affected side when lying, support the affected side upon walking. Okay, so ito yung mga makakatulong. Ito yung mga nakatulong para mawala yung kanyang pain. And then you provided with reading materials and turned on television for viewing. This is like distraction, okay? Para hindi niya maisip yung pain. And then, since nag-request siya ng medication, for example, sinabi ng doctor based on his order, bigyan siya ng constant 500 milligram, 1 tablet by mouth, okay, that is for pain, as prescribed by the physician. And then at 10:30 a.m., so that's 10 o'clock, ano? And then on 10:30 a.m., the evaluation. So after 30 minutes, ang sabi ni pasyente, the pain level is 2 na lang. Okay? Basing on the 0 to 10 pain rating scale. So no more facial grimace. And then ablated 10 in hallway with one person accompanying. Okay? So, and then afterwards, nurse's signature, yung signature nyo. So, this is the API charting. Next, ito, we have the SOPI charting. Okay? So, yung SOP kanina, or yung nabanggit nating SOP kanina, wala lang yung IE. So, ito, SOPI. So, with I and E. So, the SOPI charting is used to record progress with problem. Okay? I mean, used to record progress with problem-focused charting. So, the progress notes include narrative notes as well as flow sheets, and they are used by all members of the health team. So, dito tayo nag-chart. Okay? Sa progress notes. Okay? Dito tayo naglalagay ng mga information to our patient. Okay? So, they are specifically related to a problem list and are numbered and titled accordingly. So, it's like yung API charting natin kanina. So, problem-focused din siya. Okay? So, paano yung process? SOPI. S is the subjective data, O is the objective data, A is the assessment, P is the plan, I is the intervention, E is the evaluation. Okay? Pero kung titignan nyo guys, assessment, parang included na talaga na dapat dito, di ba? Si subjective and si objective. Pero dito kasi, in this case, pinaghiwalay niya pa. Okay? Pero usually, si assessment naman, di ba? Under niya na si subjective data and si objective data. Sige, so now we have here an example. Okay? Pero in this case pala guys, yung A, so like for instance, in this example, yung A, we usually place sa assessment yung ating like nursing diagnosis. Sige, let's see the example. So for in this case, October 19, 2021, this is the date. And then yung time of your shift, like for example, 8. Okay? 8 a.m. You receive patient awake kung gising siya, dangling on bed. So this is another example on how you receive a patient. So parang ano lang din siya, no? Parang yung narrative charting. Kaya lang, sa narrative charting, we do not indicate kung ano yung S, ano yung O, ano yung A, P, I, E. Okay? So, dire-diretso lang siya. Pero in this case, sa SOPI, ayun, nilalagay natin yung letters na yan, yung different parts na yan. So again, dito sa una nilalagay natin yung mga how we receive the patient. So ayun, receive patient awake, dangling on bed, and then with oxygen at 2 liters per minute um yung kanyang flow rate, and then via nasal cannula, yun yung kanyang mode of administration of the oxygen. Tapos, with IVF, we already know this, intravenous fluid of plain normal saline solution 1 liter times 80 millimeter per hour. Okay, so it's like 80 ml dapat yung makonsume sa 1 liter na to sa PNSS for every hour. So, yun yung ibig sabihin nun. So, hindi siya naka-drops per minute. Instead, nakalagay dito kung ilan yung ml per hour yung makonsume. Okay? Patent siya, infusing well. So, ibig sabihin, okay yung ating IVF. Okay? Nag-i-infuse siya na maayos sa ating pasyente. With Foley catheter to gravity drain. So, ibig sabihin, yung Foley catheter is naka-attach ng maayos with our patient or to our patient. Okay? So, this is how we receive the patient. So, yun yung una natin document. And then we now proceed with the SOPI. So, S is the subjective data. So, for example, ito yung mga verbalization ni patient. So, in this case, ito yung ating example. Um, in your dialect to, ano, Hiligaynon ba ito? So parang dialect yung ginamit na language. So nagabara ang sipon sa ilong ko. Nabudlayan ko maginhawa tungod dira. Okay? So as verbalized by the patient. So kapag sinabi ng pasyente, so yan yung lagi nating nilalagay. Okay? And then for the O is the objective data. So ito yung mga na-observe natin, ano, yung mga na-measure. So dito, nilagay natin nasal secretions seen upon inspection. Okay? And then for the A, this is the assessment pero commonly we are using here yung ating like the diagnosis, nursing diagnosis. So in this case, nilagay dito is ineffective airway clearance related to retained mucus secretions. T, this is the planning to clear nasal passages to promote better breathing. By the way, itong A, makikita nyo to, yung mga pwedeng ilagay dito in the NANDA book. Okay, NANDA. Or yung mga pang NCP book. Okay, yung mga nurses pocket guide. Okay, and then, P, again, we wanted to clear the nasal passages. And then letter I, this is your intervention. So instructed patient to slowly blow nose on a wet washcloth. And then another intervention, prepared a hot water on a deeper and made patient inhale the vapor. And then another one, instructed to increase oral fluid intake to clear up secretions. And then evaluation is the last part. So ito na, another verbalization. Sabi ni pasyente, daw naghalong na paginhawa ko. Okay, as verbalized by the patient. And then at 4 p.m. and endorsed na siya. And then again, do not forget to sign. Pero guys, ang common na ginagamit natin na charting ngayon is, yun na nga, si FDAR charting, which is mamaya madidiscuss ko. And yung kanina na na-discuss ko, ginagamit pa rin siya in some other hospitals, yung narrative charting. Okay? So, dinidiscuss lang natin lahat to para you have the idea kung paano sila gawin and paano yung process nila. And now, ito na tayo, the focus charting or si FDAR charting. So, it addresses the client problems or needs and includes a column that summarizes the focus of entry. So, it does not necessarily require the use of nursing diagnosis. Okay, so dito sa focus or FDAR charting, we are focused to a specific problem or to a specific condition or symptoms or signs ni pasyente na gusto nating ma-resolve. Okay? We are focused sa specific needs of our patient. So, the process is DAR. So, D is for the data, A is for the action, R is for the response. So, let's start first. So, again, we have 3 columns, ano? Just to show you ito. We have 3 columns in charting for FDAR. So, again, this is the nurse's notes. And we have the first column is the date and time. The second is the focus. And then the third one is the DAR or yung date, action, and response. So yung date and time, again, nilalagay lang natin dyan kung ano yung date ngayon and the time of our duty. Or kung anong oras natin ginawa yung, for example, yung procedure or yung focus na naisip natin kung anong oras siya na nag-transpire. So, now, let's see kung ano yung mga pwedeng ilagay sa focus. So, focus, it is a nursing diagnosis pero ano again, hindi not necessarily na puro nursing diagnosis yung nilalagay sa focus. We can also place here a sign, a symptom, na present in a patient and also any changes that you can see towards the patient. So ito yung kagandahan sa focus or sa after charting. Hindi lang yung nursing diagnosis yung nilalagay natin, but we also include here anything as a nurse na gusto nating i-focus para makatulong sa pagpapagaling sa pasyente. Okay, kung ano yung na-observe natin, kung ano yung nakita natin sa pasyente na immediate na dapat nating matugunan, so that will be our focus. Pwedeng signs yan, pwedeng symptoms, or kahit anong changes or condition ni pasyente. Okay? Now, what are the examples of different na focus na pwede nating ilagay? So, for nursing diagnosis, again, makikita to. Kung gusto mo yung focus sa ating NANDA or yung mga nursing diagnosis, you just refer sa NANDA natin. Examples are increase in body temperature, ineffective airway clearance, alteration in comfort. This for fluid deficit. So again, dapat individualize tayo. It will be based on the patient's condition. Siyempre, kung ano yung nakikita mo sa pasyente, yun yung ilalagay mong focus. Note, you can also write sa focus yung mga signs and symptoms such as cough, fever, pain, vomiting, among others. Okay? So, kung ano yung na-observe mo or yung nakita mo. Again, this is the example of the FDAR charting. And then, next, after the focus, so yun na, yun yung, kahit ano lang, one word or few words lang or statement, yun nilalagay natin sa focus. Now, we are now going to proceed kung ano yung nilalagay naman natin dito sa DAR or data, um, action, and response. So, for the data, it is like an assessment phase of nursing process wherein you write the vital signs, behavioral changes of a patient, and other observation towards the patient. So it can be both subjective or objective. So ito yung assessment, kumbaga in the nursing process. So we begin with subjective data, kung ano yung sinabi ng pasyente, and then objective data, kung ano naman yung nakita or na-observe or na-measure natin. So example, na pwedeng ilagay sa data, masakit katawan ko. So quote unquote. And then temperature of 38 degrees Celsius, blood pressure, facial grimace, ito na yung mga objective, facial grimace, ito nga yung temperature, BP, on and off fever noted. Okay, so these are all na pwedeng ilagay sa data. Kung ano yung minamanifest ni pasyente. And then for A, so that's for the data. We now proceed sa A. A is action. It is a nursing intervention or implementation. Okay? So, ito na yung mga ginawa natin para makatulong sa pasyente. Example, fever or ayun na nga, mataas yung temperature niya. The intervention is a tepid sponge bath. Ginawa natin siya continuously. We encourage the patient to increase oral fluid intake, safety measures rendered, among others. Kung ano pa yung different actions na ginawa mo para makatulong sa pasyente. Okay? So, next, R is for the response. It is an evaluation phase of nursing process or outcome of the patient. So, it can be subjective or objective. So, yung response, ito yung evaluation natin. Kung ano yung naging resulta ng ginawa natin sa pasyente. So, subjective, pwede rin siyang verbalize si pasyente, or objective, yung ating naging measurement after the intervention. Examples are temperature from 38 naging 36 na lang. BP 120/80. Tapos sinabi niya, okay na ako. So, that is a subjective data. Okay na ako. Okay, so, ito naman yung example of the FDAR charting na naka-column. Okay, so, for instance, date and time. So, you have here the date and then, andito yung time. And then, focus. So, kung ano yung focus mo, kung ano yung problem, and then DAR, ito siya. So, in this case, we have multiple focus here. We have multiple like problems here. So, ang una, at 8 a.m., ang focus mo is ineffective airway clearance. Paano mo nasabing ineffective airway clearance? So again, we document first sa DAR kung ano yung paano natin na-receive sa pasyente. Example, receive on bed with IV of PNSS 1 liter for 10 hours with oxygen at 2 liters per minute via nasal prong with NGT in place. So this is how we receive the patient. So ito yung mga contractions ng pasyente. Yung mga nakahook sa kanya, yung mga nakalagay. And then, for the D, again, D is data. Ano yung na-observe natin? So, crackles noted upon auscultation. Okay, in-auscultate natin using our stethoscope. So, may narinig tayong crackles. And then the RR, respiratory rate is 29 cycles per minute. Oxygen saturation is 93%. So, mababa. Okay, medyo mababa siya. And therefore, so these are the data that we have collected. After the data, we have the action. So, ano yung action mo para matulungan yung kanyang breathing or yung kanyang paghinga. So, place on semi-Fowler's position. So, through positioning, di ba? Again, yung mga nursing interventions lang ha. And then, salbutamol nebulization. One nebule given through pulmoaid inhalation as necessary medication or as needed medication, PRN siya. Okay? Pag kinakailangan, we give salbu or salbutamol through nebulization. Okay? So, that is one of the action as this one commonly definitely prescribed by the physician. And then R, the response of the patient, for example, at 9 a.m., from 8 a.m. to 9 a.m. Yung kanyang response. Okay, yung ating evaluation is oxygen saturation. So, tumaas na siya, nag-improve siya. From 93 kanina, ngayon is 96%. And then yung RR, from 29 cycles per minute, now is 25 cycles per minute. So, if na-solve natin yung problem, okay na tayo with the first focus. So, you close your DAR again, pero again, it will depend on your institution or sa pinagtatrabaho ng hospital. They will give you instruction about this. Okay, so pero this is an example. And then after 9 a.m., okay na yung airway ni pasyente. Now, come 12 p.m., nagkaroon siya ng another difficulty of breathing. Nahirapan naman siyang huminga. So, wala nang addendum, hindi ka na maglalagay ng addendum dito because this is another focus. Okay? Another problem yung kino-consider natin dito. So, no need to place addendum here. Kapag narrative charting, dun tayo madalas. Kasi, pag narrative, chronological order dapat talaga. Kung paano nag-transpire yung event. Okay? According to time. Pero dito, again, our focus is the problem. Okay? Yung problems that we have noted to our patient or yung problems na gusto nating ma-resolve with our patient. Okay? So, for example, 12 p.m., DOB siya, difficulty of breathing. Data natin, the respiratory rate is 34 cycles per minute. Oxygen saturation, ayan, mas bumaba, naging 90% na lang. So, ano yung action mo? The doctor on duty informed kasi this is like an emergency situation. So, immediately you inform the doctor on duty and then intubation set standby as ordered. So, this is an emergency situation. And then diazepam, 5 milligrams given. IVT as stat order. Okay, IVT yun na IVT as stat order. And then, intubation done by Dr. Oiko. Okay? And then, afterwards, 12, so from 12 p.m., 12:10 p.m. naman, ang sumunod mong na-notice or naging condition ni pasyente is absence of pulse noted. Again, yung focus, it could be either like a condition, progress, pwede rin. So, again, yung focus natin, hindi lang siya problem. Okay? Hindi lang siya signs and symptoms. It could be a condition or a situation or even a progress in a client situation. Okay? And then D, yun. So absence of pulse noted na at 12:10. So the data, the pulse rate is unappreciated. So nahirapan ka ng kapain yung kanyang pulse rate. Action. So cardiopulmonary resuscitation started. So sinipr mo na siya. Nag-aagaw buhay na si pasyente. Dr. Oiko informed. So you inform si doctor on duty. And then epinephrine 1 ampule given IVT as ordered. And then cardioversion done by Dr. Oiko at 200 joules. And then epinephrine 1 ampule, another shot was given as ordered. And then folks appraised of patient condition by Dr. Oiko signed the DNR. So, nag-DNR na yung kanyang mga relatives or the significant others. Kinausap sila ni doctor and then nag-sign na lang sila ng DNR. And then at 1 p.m., ito na yung naging response ng pasyente. So, ECG tracing revealed a systole. Ibig sabihin, nawalan na ng rhythm yung kanyang heart and then pronounced clinically dead by Dr. Oiko and then post-mortem care done and then brought to the morgue. And then after the response, definitely you have to sign, okay, the chart. Okay, so this is an example of a FTAR chart with multiple focus. Okay, so ito yung nag-transpire kay pasyente for your whole shift. Okay, so I hope clear ito, no? By the way, ito, isang response na lang. Although there are multiple focus here, so pwedeng after na lang, kasi this is an emergency situation, kaya yung response, yung pinakadulo na lang nilagay. Okay? So there. Next. Now, what are the different guidelines? So we are done now with charting, with the different types of charting. So you have narrative charting, the API, the SOPI, the FTAR charting. So meron pang iba, pero again, the most common and yung ginagamit natin talaga here in our context are narrative charting and this one, the FDAR charting. So, dapat matuto kayong gumawa kung paano mag-chart nitong FDAR and narrative charting. So you have to make yourselves comfortable and familiarize yourselves how to chart in this format. Okay, so now we are going to discuss guidelines in charting. Okay, so this is an example of a metal chart. Dito natin nilalagay yung ating mga papers. Okay, yung chart ng pasyente. Okay, so these are the general guidelines na sa pag-chart. So number one, be sure to know the agency policies and procedures about documentation. So paulit-ulit tayo dito na you have to know, you have to be oriented first kung ano yung policy ng inyong hospital na pagdudutihan about documentation. Same for admission and discharge, kung paano mag-admit at mag-discharge ng pasyente. Do check the name on the chart before making an entry. So make sure na tignan muna yung pangalan ng pasyente sa chart bago ka mag-document. Kasi baka mali pala, hindi pala yun yung patient na dapat mong pag-chartan or paglagyan ng document. So you have to be mindful of that. Okay, so write the name and identification number of the client on each page. So bawat papel ng or bawat sheet ng patient's chart dapat andun yung kanyang name and identification number para pag nawala or nahiwalay sa patient's chart, alam natin kung kanino yon specifically. Number three, always read the note written by other health team professionals before you write your own to maintain continuity of care. So basahin mo muna yung chart ng yung sinundan mong shift para alam mo kung ano yung mga nangyari, kung ano yung mga ginawa niya. Okay, so and then kung baka may mga notes siya do'n or may mga nag-transpire na dapat mong malaman, so you have to go back to the previous shift or shifts if that is the case. And then spell correctly, ayan, yung kanina or I mean, you have to um, spell correctly lahat ng terms, lahat ng words na gagamitin ninyo or na i-chart or i-document nyo. Chart accurately and only after procedures have been done. So, mag-chart ka lang every after you have performed the procedure to your patient. And then do not delay documentation until the end of the shift. Wag naman yung masyado mong ide-delay or ipagpapa pagtatagalin mo pa yung documentation. So dapat once na matapos, chart. Kaya lang minsan because of the toxicity or sa sobrang daming ginagawa ni nurse, um, medyo nagkakaroon ng problema in terms of advanced charting and in terms of sa pagka-delay ng kanyang chart. Kasi sometimes toxic or marami talagang ginagawa si nurse. Okay, so ayun. Next, number 6, chart the time with each entry. So, laging may time yung mga entries na to. Letter A, chart in present or past tense depending on the situation or depending on the hospital's policy. So, commonly, past tense yung ginagamit natin. Okay, nagawa na natin yung procedure sa pasyente. Chart all procedures done for the client and the result and the client's response. So, lahat ng procedures na ginawa natin sa pasyente, assessment, intervention, and then yung response sa pasyente, nilalagay natin. And then chart your observation objectively. By describing the behaviors, you use objective measurable terms such as time, severity, location, duration, amount, size, frequency relationship to each occurrences. So gusto natin yung mga chart lang natin are objective data. So we are not subjective in terms of our feelings or in terms of our ideas. So hindi tayo naglalagay ng opinions sa charting ni pasyente. Only facts are allowed. Then document subjective data. Again, pag subjective data, it comes from your patient, not your subjective interpretation of events. So we don't want to be biased in our charting. Use the word states, okay, quote unquote, and put quotation, ayun nga, quotation marks around any statement made by the client or family member. Be sure to indicate who made the statement. For example, the client verbalized or masakit ang tiyan ko as verbalized by the client. So that's how we write that subjective information. On a chart, no complaints or or C/O. If a client had no complaints, he or she would not be in the hospital. So, hindi tayo naglalagay ng the patient has no complaint or has no complaints. Okay? So, yun. Avoid vague words like normal, good, or adequate. Seems to be or appears to be. So, parang hindi ka sure. Okay? So, you have to avoid this kind of words. Vague siya. And then do report and document failure of client to follow regimens and to take medications or receive treatments and the rationale given by the client. So kung ayaw niyang sumunod with the regimen or sa doctor's order, i-document and then you state the reason why. Kung bakit hindi sinunod ni patient or hindi nagawa ni patient yung regimen sana na in-instruct natin sa kanya or yung order na binigay sa kanya ng doktor. And then chart safety measures, yung mga ginawa nating safety interventions for the patient, you have to chart. For example, bed on low position, side rails up, restraints applied, visual safety checks, rounds done, or with family member in attendance. So, ito yung mga safety measures na kadalasan na ginagawa natin. Chart all occasion when a client leaves the unit. So kung umaalis si client sa unit, you document it. The time left and kung kailan siya bumalik. Destination, kung saan siya nagpunta, and the mode of transportation. Chart all the specimens obtained. Okay, yung mga nakukuha nating specimen for lab. Any abnormal characteristics of the specimens and where and when the specimen was sent. And then always document in the client's progress notes when you observe letter A, number one, change in its condition or the development of a new problem. Okay, kung magkaroon ng progress or ng bagong development sa condition ng pasyente, we chart in the progress notes or in our nurse's notes. Lack of change in condition that will need further evaluation or referral, response to treatment or medication, and response to teaching. Do not skip lines or write between lines. So draw a line through any blank spaces. So for example, this is a line. So wag kang mag-i-skip ng one line. So dapat fully occupied lahat ng lines na yan. Para walang pwedeng maisingit yung kung sino man. Okay? And then do not chart for someone else. Huwag mo ipag-chart yung kasamahan mo. And do not sign for anyone else's entry. Do not erase. Ito, kagaya pong sinabi natin kanina. Now, how do we correct wrong entry? So, draw a line through it. The error must be readable. And then write the word error or mistaken entry and your initial above it. So, for instance, ito yung charting natin. So, client complains of pain. 6 on a 0 to 10 pain scale. And then, when position on left, on right hip. Pero dapat ang susulat mo pala dito is left hip. Pero ang nalagay mo is right hip. So how do you correct this one? Again, you should not white out. You should not erase. So this is how we correct this one. So maglalagay lang tayo ng line dito sa ating gustong tanggalin or gustong ibahin. So draw a line here. Ayan, just like this right hip line. And then above it, ilalagay mo mistaken entry or pwede rin namang error. And then, pero mas okay yung mistaken entry, ano. And then your initials or your signature and then yung date. Okay? Or yung shift. I think this one is the shift yata yung nilagay dito. Or, pero ang common lang is yung mistaken entry and then yung iyong signature. So that's how you correct your error or your mistaken entry without erasing. So again, just draw a line doon sa gusto mong i-correct and then ilagay sa taas mistaken entry and then your signature or your initials. Sometimes pwede na yun. Okay? So, that's it. And then, ito na. Nilagay niya na rito. Ayun, left hip pala and then signature niya ulit. Okay? So, that's it. So, again, word error or mistaken entry on top and then your initial above it. Your initial or your signature. Okay? Pero commonly is the initial nga will do. Number 11, do make addendums as necessary. I already discussed how to make an addendum sa inyong entry or sa inyong documentation. Protect the confidentiality of all documented information. So definitely, you have to consider that document as a private information or as a private part or I mean private private thing, di ba? Because it's a legal document, so dapat hindi kung sino-sino yung nakakakita nun. Only the healthcare professionals involved in care. And then aside, although meron pang separate discussion to that, pero yun yung isa sa mga basic. Okay? Kung sino lang yung involved sa care sa pasyente, siya lang yung pwedeng mag access dito sa document ni patient. And then do not write opinions or bias statements. So again, As a nurse, we have to be objective. We do not want our own opinions in our charting. Okay, so and then number 14, document all visits and consultations by the doctor and other caregivers, including yung mga telephone conversations if ever na meron. So we document that. Okay, and then if you question a doctor's order, document your question and how it was answered. Okay, so kung meron kang tingin mong hindi dapat na or hindi rational yung naging order ni doctor, you have to raise that to your doctor and then i-document mo how it was answered or how the doctor responded to your question or to your concern. So note your questions and how you acted and then document the discussion, the date, and the time. Because documentation can save you kapag ka may hindi magandang nangyari sa pasyente at the problem is in the doctor's order. You have to first again always verify the doctor's order. If you have questions about it, you have to confirm or to clarify your concern to the doctor. Don't name anyone who becomes involved in the client's care, including managers, primary care providers. So you give name sa mga nagra-rounds or sa mga tumitingin sa pasyente. Okay, and that would include all of my basic or the most important concepts that you have to know when it comes to guidelines in charting and yung sa different types of charting in the nurse's notes. So more details will be given to you during your lecture sa NCM 103 or Fundamentals of Nursing Practice lecture part. Thank you very much and God bless.